Good afternoon, Bahamas. The Ministry of Health welcomes you, the public, the media, and others to our latest COVID-19 update. Today, we begin as usual with Minister Wells. Minister.
Thank you, CMO. Good afternoon, Bahamas. Here is the latest national COVID-19 report. On Tuesday, the 6th of April, 2021, there were 26 newly confirmed cases of COVID-19. This brings the total number of confirmed cases in the Bahamas to 9,296. Currently, there are 9 moderately ill COVID-19 patients hospitalized in the Grand Bahama healthcare system. There are no patients currently in intensive care in Grand Bahama. Here in New Providence, there are 14 hospitalized COVID-19 patients at Doctors Hospital. 11 are moderately ill, and 3 are currently in the intensive care unit. There are 2 moderately ill COVID-19 patients being treated at the South Beach Acute Care and Referral Center. At the Princess Margaret Hospital, there are 7 moderately ill patients with COVID-19. There are no patients in the ICU at PMH at this time. In all, there are 240 active cases of COVID-19 in country. 82 persons have been recently classified as recovered from COVID-19. This brings the total number of recoveries to some 8,811 for a recovery rate of 94.8%. Fortunately, there was no deaths confirmed yesterday. The total number of confirmed COVID-19 deaths now stands at 189. 17 deaths remain under investigation, and 1 COVID-19 death to us in the Ministry of Health, as I've said previously, is still one too many. We continue to pray for the families in the Bahamas who have lost loved ones to this persistent plague, this unrelenting COVID-19 pandemic. Ladies and gentlemen, a total of 78,357 RT-PCR tests have been carried out for COVID-19 in country. 240 tests were performed yesterday with 26 positives and 210 negatives. 4 tests were repeated to determine recoveries. There were no inconclusive test results. On behalf of the government of the Bahamas, we again thank the nurses, doctors, emergency medical services, and other essential healthcare workers for their continued dedication and devotion to caring for COVID-19 patients. We also thank their devoted families. My fellow Bahamians and residents, the Ministry of Health has been closely monitoring the increase in the number of confirmed COVID-19 cases and hospitalizations since March 2021. There has been a marked increase in COVID-19 positive cases on the islands of New Providence, Grand Bahama, and Abaco. The same trend has also been noted on the island of Eleuthera. Last week, a healthcare team was dispatched to Eleuthera to assess and intensify contact tracing activities there, with special emphasis on Harbor Island. The team completed the following task. They determined the number of COVID-19 positive cases, assessed whether there was a need for widespread testing, evaluated the manpower on the ground to enforce policies and procedures, commenced the rollout of our COVID-19 vaccinations, made recommendations for improvements, which include the acquisition of additional staff to augment the existing staff complement on the island and to encourage residents and visitors to adhere to the public health guidelines. The health team trained personnel on updated protocols and quarantine and isolation. Due to limited staff, difficulties were noted in conducting complete contact tracing activities and enforcing quarantine and isolation measures on Harbor Island. Ladies and gentlemen, notably, there has been an overall increase in the number of hospitalizations in the Bahamas since March of 2021. Hospitalizations in particular for March 2021 were the highest on Grand Bahama, followed by New Providence. However, based on yesterday's data, hospitalizations in Grand Bahama decreased. Health officials will continue to monitor this situation. Currently, there are a total of 23 beds available on the island of Grand Bahama for COVID-19 patients. 16 beds at the Cancer Association of the Bahamas, and 7 beds at the Infectious Disease Center. The Ministry of Health stands ready to cope with the current number of hospitalizations in country. My fellow Bahamians and residents, with the emergence of COVID-19 variants in the United States of America, the question continues to arise: are any COVID-19 variants in the Bahamas? 52 COVID-19 positive samples collected from New Providence, Grand Bahama, Eleuthera, Exuma, Bimini, and Andros were sent to the Fiocruz laboratory in Rio de Janeiro, Brazil, for baseline genomic sequencing analysis. 28 of these samples were successfully sequenced. None of the samples were found to have COVID-19 variants of public concern. When a variant is of public concern, this means it can affect the transmissibility of the COVID-19 vaccine virus or affect the efficacy of the COVID-19 vaccine being administered. The results show that there is no evidence of variants of public health concern in the Bahamas at the time the samples were taken. However, our healthcare professionals remain vigilant in this regard. The National Reference Laboratory received reagents to conduct initial screening for the mutations that characterize variants of concern. Additionally, the laboratory will utilize RT-PCR-based techniques to detect these variants. These tests will provide further insight into the transmission and prevalence of variants of concern in the Bahamas in real time. This testing will also help the National Reference Laboratory to prioritize samples for genomic sequencing. 10 samples collected in March 2021 were sent to the Caribbean Public Health Agency, CARPHA, this past week to conduct sequencing. The National Reference Laboratory has also developed a new National Respiratory Surveillance genomic database where COVID-19 genomic sequencing will be deposited for genetic analysis at a higher level. This will improve surveillance data and epidemiological decision-making. Ladies and gentlemen, as we emerge from the Easter celebrations, let us continually reflect on the resurrection of our Lord and Savior, Yeshua the Christ. We are grateful to Almighty God, the Lord of life, for this season of life. In appreciation for the sanctity of life, let us continue to adhere to the public health precautions. Wear your mask, continually practice social distancing, avoid large gatherings, and do not forget to frequently wash your hands. We must not let our guards down. We must continue to take the necessary precautions. We must work hard to prevent the possibility of a third wave here in the Bahamas. My fellow Bahamians and residents, COVID-19 vaccinations are now available in country for specific priority groups. The vaccination campaign has been moving along successfully. So far, the Bahamas has received a total of 53,600 doses of the AstraZeneca vaccine. 20,000 doses were received as a gift from the government of India. 33,600 doses were received through the COVAX facility with the assistance of the Pan American Health Organization. I am grateful to have here present the Pan American Health newly appointed country representative, Dr. Eldona Boussaint. We welcome her participation here in this press conference today. Continuing with PAHO, the Bahamas is scheduled to receive an additional 67,200 vaccines through the COVAX facility. The government continues to work on all fronts to secure additional vaccines from approved providers. To date, more than 10,000 first doses of the COVID-19 vaccines have been administered to Bahamians and residents. We are vaccinating over 1,000 individuals per day, and we are actively working to increase this number. Vaccines have been administered at centers in New Providence, Grand Bahama, and Eleuthera. Currently, vaccinations are open to the following persons at this time: healthcare workers, persons 60 years of age and older, uniformed branches, the Royal Bahamas Police Force, the Royal Bahamas Defense Force, the Bahamas Departments of Corrections, Customs, Immigration, and the COVID-19 ambassadors. Teachers and staff of schools, homebound physically challenged residents, students and athletes studying or competing abroad, and hospitality workers, hotel and resort employees, public transportation workers, Lyndon Pindling International Airport workers, Nassau Airport Development Company, Nassau Cruise Port workers, the straw market, port and beach vendors, and tour operators. Others will soon be added to this expanding list. Vaccinations resumed today after the Easter holiday at Loyola Hall and the Church of God East Street on New Providence, and at Susan J. Wallace Community Center on Grand Bahama. Additional vaccination sites will open on New Providence this week. On Thursday, the 8th of April, tomorrow, the Kendall G. L. Isaac Gymnasium will be used as a vaccination center. On Friday, the 9th of April, vaccination sites will be opened at the Atlantis and Bahama resorts for hospitality workers. To make an appointment online, visit www.vax, that's vax.gov.bs. Those who do not have access to the internet on New Providence may utilize the Church of God of Prophecy East Street site. For general inquiries about the COVID-19 vaccine, please call these numbers: 502-7382, Monday to Friday, between the hours of 9 a.m. to 5 p.m. The COVID-19 hotline at 376-9350, every day between the hours of 8 a.m. to 8 p.m., or 511. Health officials and the National COVID-19 Vaccine Consultative Committee will continue to provide regular updates as it relates to the rollout and distribution of the COVID-19 vaccine. I take this opportunity to encourage all to take the vaccine at the earliest opportunity when it becomes available for your group or subset of our population. Before going to your vaccine appointment, ensure that you have a good night's sleep. Rest can assist with your immune system's response and functionality. Also, eat a meal and drink some water. Do not go to your appointment hungry or thirsty. If you are on medication, remember to take your medication as usual or under the advice of your doctor. The Ministry of Health is aware that some Bahamians may have obtained their COVID-19 vaccine in the United States. The Ministry of Health requests that persons who have obtained a vaccine from outside of the Bahamas relay that information to us soonest. Please call us at 502-7283, 376-9350, or 511. Report that you have already taken the vaccine and leave your name, the date you received the vaccination, and the country where the vaccine was obtained. Also, which vaccine it was that you received. This allows the Ministry of Health to update its local records and properly allocate vaccines and to properly account for you. Ladies and gentlemen, as we work to limit the spread of the virus through vaccination, stay disciplined. We are a disciplined people. Be vigilant, take personal responsibility, and continually apply public health preventative measures. Let us continue to work together to make our country safe from COVID-19. May the Lord of life, our God, bless you and continue to keep you, and may He bless and keep your family. And may God Almighty continue to bless and keep this great Commonwealth of the Bahamas. CMO.
Good afternoon again, Bahamas. It is my pleasure now to welcome Dr. Eldona Basson, Pan American Health Organization, World Health Organization local representative, to provide a few remarks. Dr. Basson?
Good afternoon, ladies and gentlemen. Today, April 7th, is World Health Day, and the theme for this year is Building a Fairer, Healthier World. COVID-19 has unfairly impacted some people far more harshly than others, intensifying existing inequalities in health and welfare, both between and within countries. So, for World Health Day this year, the World Health Organization is issuing 5 calls for urgent action to improve health for all people. 1, accelerate equitable access to COVID-19 technologies between and within countries. And that's not just vaccines, but also medicines, tests, and personal protective equipment. 2, invest in primary health care. As countries move forward post-COVID, and we will get to post-COVID, it will be vital to avoid cuts in public spending on health and other social sectors. Governments are encouraged to meet WHO's recommendations. The target for spending an additional 1% of the GDP on primary health care, and to reduce the shortfalls in healthcare workers in order to achieve universal health coverage and access. Number 3, prioritize health and social protection. In many countries, the socioeconomic impacts of COVID-19, through loss of jobs, increases in poverty, disruptions to education, and threats to nutrition, have exceeded the public health impact of the virus itself. Number 4, build safe, healthy, and inclusive neighborhoods. For example, by providing basic social services, improving transport systems, water and sanitation facilities, ensuring access to healthy housing in safe neighborhoods with adequate educational and recreational amenities. All of these are key to achieving health for all. Number 5, strengthen data and health information systems. It is necessary to increase the availability of timely, high-quality data that is disaggregated by sex, wealth, education, ethnicity, race, gender, place of residence, as this is key to working out where inequalities exist and to addressing them. It's often those who are most vulnerable, the poor or discriminated against, who are the most likely to be missing from health data and information. Globally, COVID-19 cases have been on a consistent rise over the last 6 weeks. And over the last 3 weeks, deaths have also been rising. Globally, there's been more than 131 million COVID-19 cases and over 2.8 million deaths, with nearly half of these cases and deaths occurring right here in the Americas. And in the last 24 hours alone, in the Americas, there have been more than 154,000 cases and more than 3,000 deaths. However, on the bright side, globally, over 604 million vaccine doses have been administered. And this is a hopeful step in the response to the pandemic. In the past 2 weeks, most countries in the Caribbean have received COVID-19 vaccines through COVAX. As you know, last Tuesday, the Bahamas received 33,600 doses, and another 67,200 doses are scheduled to arrive in May. As more vaccines get WHO emergency use approval and manufacture of vaccines is scaled up, we anticipate that vaccine supply through COVAX will steadily increase in the coming months. COVAX is the best option to offer vaccines with equity as we move towards building a fairer, more equitable, and healthier world. In the words of the Director General of the World Health Organization, Dr. Tedros Ghebreyesus, no one is safe until everyone is safe. And PAHO is proud to work with and to support the Bahamas, and indeed the Americas, in achieving universal access to health and universal health coverage, not just in response to the COVID-19 pandemic, but with respect to all health issues and all health-related issues. Universal health coverage and access means that all people and communities have access without any kind of discrimination to comprehensive, appropriate, and timely quality health services according to their needs, as well as access to safe, effective, and quality medications that are affordable, ensuring that the use of these services does not expose people, especially the most vulnerable groups, to financial difficulties. COVID-19 has worsened inequalities both between and within countries. The poorest and most marginalized have been hit hardest, both in terms of lives lost and livelihoods lost. So as we continue our efforts to reduce the transmission of the virus and mitigate the health impact of COVID-19, PAHO WHO pledges to continue to lead efforts in the region to support countries and territories in their response to the pandemic and to achieve universal health coverage and access. I thank you.
Thank you, Dr. Busson. I will now provide you with a little more information regarding some of what the minister would have brought to your attention in his remarks. So around the world, COVID-19 cases and deaths continue to increase. Globally, there are over 130 million cases and almost 3 million deaths. Nationally, the COVID-19 confirmed cases continue to rise. The number of new COVID-19 deaths are, as was stated earlier, at 189. When we look a little closer, we see that the total cases as of yesterday for for the country are 9,000, just over 9,000, 9,296. Nationally, COVID-19 confirmed cases have risen for 4 consecutive weeks. Can I have the next graph, please? 146 new cases were reported for last week, which was Epi Week 13. Though this appears to be a reduction from the week prior, it should be noted that last week coincided with Easter, when many of the testing centers either closed or had reduced operating hours, and/or many were focused on other activities surrounding the holidays. This graph looks at the same data, but from a different perspective. The average number of new cases each week was steadily rising from February 2021, which corresponds with Epi Week 8. The week of the 28th of March, which was Epi Week 13, also appears to have decreased in the average number of new cases. But we caution again, because this is the week that I referred to earlier that coincided with Easter. When we look a little closer at New Providence, we see that the cumulative COVID-19 case count is about 6,500 total cases. And we note that there continues to be an upward trend in new cases of COVID-19 in the capital. On Grand Bahama, as of yesterday, there were 1,490 COVID-19 cases. Although fewer cases were reported last Epi Week, the same caution in interpretation is echoed, underscoring the impact of the Easter holiday on persons desirous of testing and the accessibility to facilities. From the start of the pandemic to now, a total of 201 cases of COVID-19 have been recorded for the island of Eleuthera. And we note in this graph the marked increase in cases which we became aware were primarily imported or import-related. When we look a little closer at the Eleuthera cases, what we see is that as of between March 2020 and April 2021, there were a total of 21 cases, and the majority of these cases were in North Eleuthera, about 46%. Between January 21 and April 21, which is the latest data that we would have been monitoring, we see that North Eleuthera was responsible for about 81% of the cases on Eleuthera. This coincided with the spike that we saw on that island. The next graph pretty much shows the epi curve for that period, where we had the increasing number of cases linked to North Eleuthera. When we move on to Abaco, we recall that a recent surveillance mission that we sent out to Abaco due to the increasing cases underscored the need for peer accountability. The Ministry of Health, nor the police, nor the COVID ambassadors could do it alone. Family members, neighbors, friends, and co-workers must hold each other accountable for practicing the public health measures. as a reminder to all of us, things can wait that are not immediate. Abaco is now showing a consistent downward trend, which is positive. We are, however, observing a cluster of cases linked to guana key, and additionally, green turtle key is also proving to be an area of interest, with recent reports of increasing rapid antigen test positives. The graph that you are looking at is the 7-day moving average. The seven-day moving averages is another indicator or metric which we follow to assess performance, strategies, and policies specific to COVID-19. These averages smooth out the peaks and valleys, and they remove, for want of a better word, the background noise, to reveal clear trends, seen as the dotted lines on the screen. This does not, however, show a full picture. We also monitor the R0. The Ministry of Health has reported on the R0 value in the past. It is also referred to as the reproduction number, because as the infection is transmitted to new people, it reproduces itself. The R0 is a metric that uses data points from 2 weeks prior to indicate the average number of people who will get an infectious disease from one person who is infected with that disease. In this context, we're talking about COVID-19. Can we get the next slide? When R0 is less than 1, the disease is on the decline. When R0 is more than 1, each existing infection causes more than one new infection, which means the disease will continue to be transmitted from person to person. The R0 plot or graph, though specific to New Providence that we're looking at, can be seen as a representative snapshot of the entire Bahamas. For our local context, R0 is greater than 1. We have demonstrated prior, however, that we can collectively engage to get our R0 below 1. The portions of the graph that fall below the red line clearly shows that we have had a R0 below 1. Moving on to speak a little about the variants of SARS-CoV-2. Since the initial identification of SARS-CoV-2 until the 22nd of March 2021, more than 845,000 complete genomic sequences have been shared globally through publicly accessible databases. At the global level, however, to date, 3 variants of concern would have been identified. Among the factors that are used to define a variant of concern by the World Health Organization are increased transmissibility or detrimental change in the COVID-19 epidemiology, increased virulence or change in clinical presentation, or a decrease in the effectiveness of public health and social measures, or available diagnostics, vaccines, or therapeutics. In the region of the Americas, variants of concerns have been identified in 32 countries, notably countries we receive visitors from and countries that we visit. Variants of concern have also been detected in several of our English-speaking Caribbean territories. In addition to the SARS-CoV variants of concern, WHO has provided a working definition for other variants which they refer to as variants of interest. And some of the countries in the Americas are now reporting these variants of interest as well. In the Bahamas, as the minister would have alluded to earlier, we would have sent off samples, I think it was early in March, for genomic sequencing. 52 samples were sent to Brazil, 28 samples were successfully sequenced, and no variants of concern were detected. We have also sent 10 samples to the Caribbean Public Health Agency in early April, and we anticipate that in a week or two, we will have the results from those samples. That will give us a clearer picture of our current context as it relates to whether or not variants are in country. Given our proximity, however, and our traveling patterns to the areas mentioned earlier within the region that already have variants of concern, we must continue to be vigilant. The Ministry of Health, in collaboration with PAHO, as Minister would have clearly communicated a few moments ago, we are working closely to ensure that we have in-country capacity to work out sequencing of the COVID-19 SARS-CoV virus. Now moving on just a little to speak about vaccinations. Globally, we see millions of vaccination doses have been administered, and persons with at least one dose are some 315 million persons. The introduction of COVID-19 vaccines serve as an important tool to fight the pandemic of COVID-19. Around the world, more and more people are choosing to receive the COVID-19 vaccine. More than 500 million people have been vaccinated against the SARS-CoV-2 virus. And COVID-19 vaccines are here. Shots are going into arms. On the 10th of March, 2021, we got our first installment of COVID-19 vaccines, and 5 days later, our national COVID-19 vaccine rollout began. And it continues. Minister Wells reported that our progress with over 10,000 first doses continues to move forward. And yesterday, we released a new COVID. 1,473 appointments were booked in the system. The Church of God East Street vaccination site recorded the best uptake of 94% of the available slots booked over that time period. From earlier data, we know that approximately 60% of vaccine recipients are 60 years and older. More females than females have been vaccinated in the ratio of 1.3 to 1, or 54% female and 46% males. More non-healthcare workers are being vaccinated when compared to healthcare workers. In early 2021, the Ministry of Health conducted a vaccination hesitancy survey among healthcare workers. The results were similar to this real-world experience. And though they are not surprising, the ministry hopes that healthcare workers will sign up and show up for COVID-19 vaccinations. Healthcare workers have set the pace and the lead and they must lead the charge on so many other important health matters. It is only natural for them to do the same in this instance. Turning our attention to our national experience with events supposedly attributable to vaccination, or as savvy events from the COVID-19 vaccination. What we can say to you is, as of April 4th, there were 69 individuals who reported one or more events. This is less than 1% of all of the persons who would have been vaccinated. Of these, sex was not documented for 7. Sex was not documented for 7 or 10% who reported the event. Most events reported, however, were among women. This was 42 of the 69 persons, and in people between the ages of 45 and 54. All the events, and that's the slide that I think was up a few minutes ago, all of the events analyzed were classified as non-serious and mild. The World Health Organization Global Database of Individual Case Safety Records confirmed that symptoms of a flu-like illness can be expected, as generally occurs with the body's immune response to vaccines. Symptoms are usually mild to moderate and resolved within a few days. From our local experience, 69 persons reported 119 events. 21% of the reported events were due to headache, 15% fever, 13% chills, 9% body pain, 8% pain at the injection site, and 8% fatigue. Other events, each accounting for less than 5%, included injection site itching and rash, diarrhea, and dizziness. There was one report of chest pain. For this period, there was no report of any case of anaphylaxis. There have been no reports involving post-vaccination hospitalizations and/or deaths. Being vaccinated will help us to cross over to the other side of COVID-19. As we move forward, sufficient numbers of the population being vaccinated, the R0, the 7-day moving average, the infectivity rate, incident cases, hospitalization, and deaths, among others, are indicators that will help to paint the picture of our national COVID-19 state of affairs. The social media images and activities that occurred over Easter holiday weekend is somewhat concerning. We will not know the full impact of those activities on our indicators until at least the next 14 days. The adage, an ounce of prevention is worth a pound of cure, is relevant and true. We hope that as a people, we continue to conduct ourselves to ensure that we do not have increases in cases. Where we go from here depends on me and depends on you. Where we go from here is entirely under our control. Countries have seen some of the biggest spikes of the pandemic, leading to another round of restrictions and lockdowns. We must band together, follow public health measures to prevent the spread of this virus and avoid this ill-afforded fate. Things that can wait should wait. Vaccinations have started, but until we get the critical number of about 80% of Bahamians vaccinated, the only way to slow the spread of this virus remains to avoid close contact with people, wearing masks, and sanitizing. Local studies show that Bahamians know what to do. Many are tired of hearing the repeated chorus of public health measures. Moreover, there is a difference between knowing what actions can reduce transmission of the virus and putting that into practice. A night at the club can wait. Celebrations with large groupings of extended family can wait. Going out to crowded sites or events for some eats and drinks can wait. Having that party can wait. COVID-19 has already stolen so much from us. Let us not allow its rampage to continue longer than necessary. Our economic engine has just started a slow churn again. Visitors are back on Bay Street, and hotel properties are reopening. These gains could all be lost, back to square zero. If the cases continue to increase, not to mention the heartbreak of losing more loved ones and reliving the social and mental anguish of tightening restrictions necessary to limit the opportunities for the spread of this virus. I thank you, and I'd be open for questions. Jemanita Swain, ZNS.
Good afternoon, CMO. Good afternoon, Bahamas. My first question emerges from what you just indicated. I know that officials indicated initially that they had planned to vaccinate 20% of the population, and I think in your remarks just now, you indicated that the plan now is to vaccinate about 80% of the population. Can you account for the change in the numbers from the 20% to the 80% now being considered?
Okay, so the 20% related to our initial access of vaccinations through the COVAX facility. We sought to access 20% of the vaccines for 20% of the population. But the intent is for us to move in the direction of vaccinating enough persons for herd immunity, and that would be around 80%. So we are continuing to source, other opportunities for vaccinations, but the 20%, to be clear, related to our initial access of vaccinations through the COVAX facility, which would have been for 20% of our population. Second question? Related to initial access of vaccination. Oh. Matthew Moxie?
Yes, good afternoon. What is the recommendation of health officials to arrest the growing cases on New Providence and the other islands, like Eleuthera and Abaco?
The recommendation continues to be adherence to the public health measures. Certainly we would have gone to we went to Abaco and we went into Eleuthera, and our assessment pretty much points to the need for ongoing reminders of the need of individuals, businesses, to adhere to those public health measures, which would have, I think, proven, would have already reaped good benefit. We would have been in a position to open up our economy, open up schools, and we did that through adherence to public health measures such as wearing your mask continually, continuing with the sanitation, the social distancing, avoiding large events. So we continue public health, our recommendations remain the same. Adherence to the public health measures as we move now to vaccinations, which we know will assist, which is another public health measure which we are in the process of adding It's a great tool that would assist us with decreasing the likelihood of individuals becoming infected, as well as decreasing the likelihood of people having severe illness if they are affected. So we continue to make the recommendations that we did in the past, adherence to public health measures, as well as when your turn comes or as soon as you are eligible, moving forward with the vaccination. Kyle Walking.
Hi, good afternoon. We know that there are certain privileges for those who are vaccinated, like how the CDC guided that fully vaccinated Americans can now travel freely without having to quarantine or take a COVID-19 test. I want to know, is there a plan to recommend that those who are fully vaccinated in the Bahamas, that they no longer have to take a PCR test to travel, especially for inter-island travel? And while we're on that, how many Bahamians have to be vaccinated for health officials to recommend or say that we are no longer in a state of emergency?
That's a very good question. Well, certainly vaccination will help us to move down the road of both of those matters that you brought up. As it relates to the movement of the restriction to have to test, certainly I believe considerations can be made along the lines of once persons are fully vaccinated, but we are certainly not, we are not there as yet. But as we continue to move forward with our vaccination campaign, I anticipate that we will be in a position to review what the guidance is from countries such as the US, the CDC and others, the World Health Organization, as it relates to travelers not having to test. But certainly where we are currently, those measures will need to remain in place. Rashad Rowe.
Hi, good day. So a number of countries and scientists have said that for genome sequencing to be effective as a surveillance tool for new variants, 5% of COVID-19 samples should be tested. Is this the standard that you are aiming for in the Bahamas? And if not, how do you know we are testing enough samples to be comfortable that newer significant strains of COVID-19 aren't here, especially now that cases are on the rise again?
Okay, I have Dr. Martin, I think, on. Dr. Martin?
Hello, good day, everybody. So we, as you know, we lack the capacity to actually perform genome sequencing in country. So the tack that we've taken in order to meet this need is that we are going to commence shortly. We're actually awaiting the reagents to come very shortly via PAHO. We are going to commence RT-PCR-based detection of mutations that characterize the variants of concern. And what this will allow us to do, it will allow us to test in country the samples, the positive samples that we do have, and then utilizing an algorithm that's been recommended by PAHO, we will then be able to select from those that are positive for one of the 3 variants of concern. We'll be able to select those and then send those for actual genomic sequencing to an external reference lab. So that is our strategy to meet that objective. Thank you.
Jasper Ward.
Good afternoon. Today, the UK government's vaccination advisory body recommended that healthy adults under 30 be offered an alternative vaccine to the AstraZeneca. Any plans for the government to do something similar? And are there any concerns as there continues to be issues rising as it relates to AstraZeneca and its link to blood clots?
Okay, so we became aware of that article from the UK today as well. I would say, and then I would probably ask Dr. Forbes to speak to that, or I would say certainly as we move down the road of immunizations with AstraZeneca, We have to continue to monitor, what the science is giving direction to. This would have come to our attention today, and certainly considerations along that line may have to occur, but this is something that I think we all know that with the AstraZeneca vaccine, we would have had a number of things come to the fore, and as additional studies and additional information came forward, we were in a better position to make country-level decisions. So I'm not sure if Dr. Forbes is Dr. Forbes on, or Dr. Brennan would wish to add.
Yes, I'm on.
Okay, go ahead.
So, absolutely. Today, the European Medicines Agency gave an update on what is the status of blood clots and the AstraZeneca vaccine. And it is possible that these clots are a very rare side effect of the AstraZeneca vaccine. And when I say rare, there are 34 million doses of the AstraZeneca vaccine that have been administered up to April 4th, and a very small number of blood clots. Actually, the chance of getting the blood clot is way less than 0.1%. It's about 0.0065%. And so it's an extremely rare side effect that's possible. And scientists are not really quite clear on what exactly could be causing that at this time. So the overall position is that the benefits for this vaccine do still outweigh the risk of this vaccine. And there's some other useful information to know. As a matter of fact, 4 women out of every 10,000 women that is on the birth control pill will get a blood clot because of it. And COVID-19 itself can cause blood clots. And so we always have to weigh what is the benefit and the risk, and the benefits of the vaccine still far outweigh the risk, especially in the context of an ongoing COVID-19 outbreak. So as it relates to what the United Kingdom has decided, it's based upon the observation that this rare, very rare side effect is most likely to occur in younger persons, especially women. And so you have to balance it in terms of your country situation. And in that case, persons under the age of 30 would considerably be more at risk of that rare side effect of having blood clots, but they also would do far better if they got COVID-19. And so that is where that recommendation came out. So all countries will have to look at their situation and decide what their national guidelines will be, but that's some of the context, and it's still being studied.
Thank you, Dr. Forbes. Tyler Simonet.
Good afternoon to everyone listening and to the health officials. My question is, the media has recently been made aware of people alleging that they're using Doctors Hospital mobile concierge service, taking a COVID-19 RT-PCR test, receiving negative results, and then discovering that the results that have been given to them are fraudulent upon giving the test results to a COVID-19 ambassador at LPIA. Are health officials aware of this, and if you are, is there anything being done to stop things like this from happening, because people are being arraigned in the Majesty's Court for this?
Okay, so certainly if persons are engaging in activities that are fraudulent, that is something that is, a police matter. And if they are being arraigned in Her Majesty's courts for it, it would seem as if that is what should occur. Certainly we, as health officials, we put the protocols together and we make them we distribute them, and we monitor, of course, as best we can what is happening in the spaces. But certainly fraudulent activity must be brought to the attention of the police, and if it is that they are arraigned, that is generally what happens when we engage in those activities. Sloan Smith?
Hi, good afternoon. Ava Turnquist filling in for Sloan Smith. Hi, Dr. McMillan.
Hi.
In your comments, you had mentioned, I thought this was really salient, the club can wait. Traveling for non-emergent reasons can wait. As we try and urge Bahamians to be mindful of the guidelines as cases are rising. What about political campaigning? Can that wait? And what is the recommendation that health officials have given to political parties as we see the resumption of campaigning in earnest, seemingly increasing week by week over week? Is health concerned about that? Have they given any guidelines specifically to political parties? Can you speak to that?
Certainly the health guidelines and the health measures remain the same. We make the recommendations regarding, not gathering in large groups, wearing your mask. Our recommendations are based on what the science shows decrease the transmission. And all of the recommendations that we make in health, we make for the public, the general public of the Bahamas. So as it relates, I was asked that question about political parties and, if we are monitoring those activities. I had to say no, because what we do, we make the recommendations for all groupings, and we anticipate that the recommendations would be for all the Bahamas. It's nothing different for any particular grouping. So when I say, a club can wait, those kinds of things, it's all about trying to give persons the opportunity to, ensure that they do not put themselves in positions that increase the likelihood of them being exposed or exposing if they may be an asymptomatic carrier. So that's pretty much all I can say about that. Was that Sloan? Sloan? Shamako Lightborn?
Good afternoon, CMO, and happy World Health Day to all the healthcare workers in the country. So Exuma has been doing fairly well until recently. With the 5 recent cases recorded on the island, does any data reveal any commonalities between them and if they're linked to any specific area?
I think your comment is valid. Exuma has been doing well. However, we did have a reason to, raise a flag of concern. I have Dr. Jillian Bartlett, I think, on. She would be in a better position to give you the details. Dr. Bartlett?
Yes, CMO. Good afternoon, Bahamas. So yes, Exoma's been doing extremely well up until recently when we had an increase in cases, and about 6 cases in particular, 4 of which came from one family, and those were the persons that traveled internationally from Florida into Exoma. They came in with an initial negative RT-PCR test, and on day 5, we did the rapid antigen test that came back positive. And these were followed by the RT-PCR, which all came back positive. They are currently asymptomatic and being monitored by the local health team. We also had one person in New Providence that recently traveled from Exoma and was traveling back to Exoma. So she had to also do the RT-PCR to leave New Providence to travel. That also came back positive. That client is also currently asymptomatic and quarantined in New Providence. The 6th case would have come from an area in Exoma unrelated to these other 2 scenarios that presented for travel to, and that person also had a positive RT-PCR, also now asymptomatic and all being monitored by the local health team. Of note, we had recently 6 cases present to our local facility, because those cases that I previously just presented was at the private facility, 4 at one at the other, and 1 in New Providence. We had 6 cases that presented to our local facility in Exoma, of which 2 came back as negative, and we have 4 pending results. Thank you. Good afternoon.
Thank you, Dr. Bartlett. Shamako, do you have another question?
Yes, so my second question, quite simply, are you able to provide an estimation on when we can expect wider family island vaccination rollout, mainly Exuma?
Okay, certainly I would say this. We are working very closely with the National Consultative Committee, the technical working group of the Ministry of Health, and we would have started immunizations on Eleuthera, in part because of what was happening in the north. And we anticipate, well, certainly we know, you know, that we are also immunizing in Grand Bahama and doing fairly well on both, in both settings. But we anticipate that we will be focused more on New Providence over the next few days, and then early into the next week, we will be moving out a little further as it relates to the family of islands. But we are taking into consideration, you know, all of the requirements for ensuring that there is equitable access across the Bahamas, but even within the island. I'll give you a scenario. If we just go and set up, let's say, on one side of Exuma and don't take into consideration all of the other keys and, you know, the logistics associated with that, there's an equity concern there. So we are trying to work through the logistics to ensure that we, and when I say we, we're talking to NCC as well as the technical working group from the ministry. When we roll out on a particular island, we are doing it in a way that makes it easily accessible to persons, as well as ensuring that we cover all of the groupings that are eligible at that time. So long and short, we anticipate that I would say into next week or so, we will be rolling out to more islands, and I anticipate that Exuma will be one of those that we get to in short order. I'm happy to hear that you are interested. Sloan Smith, you have another question. Was it Sloan?
Hi, yes, just to follow up on the same question, I'll phrase it a different way. Is it safe to politically campaign during this time? Is that what health is advising?
I cannot answer that question any other way. Minister, did you want to answer? Did you want to hazard a... Is it safe? Following the public health measures, if, you know, that makes it, I say it again, public health measures are to be followed by all. Now, if campaigning is occurring, following the measures, distancing, mask wearing, sanitizing, not, you know, congregating in crowds, that could be safe. If it's not, then we have concerns in health. Tyler Simonet?
Yes, good afternoon. If I could just get another response, or rather clarify my first question, because it is not that these people are paying for a fake COVID-19 test and knowingly receiving their results that they know are fraudulent and not taking a swab. These people are saying that they are actually being swabbed, paying their monies, and receiving results that they don't know are fraudulent until they're seen by a COVID-19 ambassador. So it is not a case of the actual person not following COVID-19 protocols and being fraudulent. This is why I'm asking if health officials are aware of this situation and what is being done about it.
So certainly, I'm trying to understand your what you are bringing to our attention here. And certainly, if it is that individuals are going to a lab and paying for a test and I'm not clear as to what you are suggesting that the situation is here, but individuals have a right to expect that if they go to a lab and they have a test done, they get, you know, they get a correct result. And if that is not occurring, they have the option, and I would suggest that they need to report that to the Ministry of Health, as well as, you know, we have councils that have responsibility for licensing labs. But if that is reported to the Ministry of Health formally, then we will need to, do the investigation. If I'm understanding your concern correctly, we will have to do the necessary investigation and move forward with dealing with the particular facility. I'm hoping I got your query correct. Jasper Ward?
Hi there. Can you get a detailed breakdown in the spike in cases on Abaco, Eleuthera, and Grand Bahama, the trend that health officials would see there, if there are clusters or community spread? And also, you noted that there has been a downward trend in cases on Abaco. If that is the case, are health officials going to recommend that they be taken off of that 8 p.m. curfew and maybe to a 10 or 11 p.m. curfew?
I would start with the last question you asked. There is a downward trend, but we also did say that we have concerns in other parts of Abaco that we are monitoring as it relates to clusters of cases that's ongoing. So the downward trend is good, and we will continue to monitor, the trend, but we have to take into consideration other things that are going on. And to your question regarding clusters, Abaco, we are seeing clusters in different spaces. I'll let Dr. Bartlett speak to specifically what is happening on Abaco that is concerning right now, but we will be reviewing the data to determine whether or not we can relax restrictions or make the recommendation. Dr. Bartlett? Mm-hmm.
Yes, good afternoon again, Bahamas. So I'll start with Abaco. So we are, as a healthcare team in Abaco, still concerned of what's going on there. Just recently, we had 6 cases in Guanaki as a result of a construction company there, SMG. So we are watching those cases. Those persons would have traveled into New Providence and subsequently been tested here. So they are now currently in New Providence, but then you have rapid travel between, as you know, New Providence and Abaco. So right now, that's a concern. We will keep that consideration under careful watch. Also, throughout Abaco, persons move from settlement to settlement in Abaco. So north goes to central, central goes to south. So just recently, we have seen some cases in South Abaco, as well as a case in Morse Island as a result of the movement. And hence, that's why we keep saying about the public health measures, because as you move, then you transmit the virus. Right now, a concern also on Abaco is what's going on in Green Turtle Key with an increase in the rapid antigen testing. These would be persons who would come in, travel, and on the 5th day be tested by the rapid antigen test. And these tests are coming back positive. And subsequently, their contacts are being quarantined, and we continue, of course, to monitor them and the situation as we speak. So Abaco remains still a concern at this point.
Rashad Roll.
Yes, hi again. So much was written last week about a man who died in Bimini after he reportedly couldn't be airlifted because of his weight. What exactly is our capacity for evacuating people from the family islands who may be obese? And if they can't be evacuated, what is being done to ensure they get the necessary health care?
Okay, I would start, and then I'll let Ms. Walker speak to the pods that we would have purchased in order to be able to evacuate COVID-positive patients from the family islands. What I would say, certainly, I'm very familiar with the case, and it was unfortunate that we was unable to bring the case out of Bimini due to the weight restriction, and Ms. Walker will speak to the pods, but certainly it sheds light on the need for us to ensure that given our population geography, as well as our weight challenges that we have, we are seeking to determine exactly what would be the best way to accommodate a patient that we have in a particular island where we are unable to use the pod that is purchased to bring individuals in from that particular island. I'll ask Ms. Walker to speak specific to the restrictions that come with the pod.
Good afternoon, and thank you for your question. There is a weight restriction with respect to the isopods. That is 270 pounds. And so persons who exceed that weight limit, the pod will not be able to afford the protection of the other persons who would be traveling in that same vessel, whether that vessel is an airplane or a boat, if the pod is not secured based on the programmed weight limits.
Okay, so thank you, Ms. Walker, for that clarity. And certainly, as alluded to earlier, it's clear that we have to seek to determine the best way for us to be in a better position to manage persons beyond the weight limit of the pods. And certainly all efforts are being put forward to determine exactly how we will do that in the shortest time to prevent us from being in that position again in the Ministry of Health. Was that Kyle walking? It's him now. Kyle?
It's me.
It's you.
Not trying to beat a dead horse, but respectfully, there are families being told that they can have a limited number of relatives to bury a loved one, similar for weddings. However, there are political organizations having events with crowds and calling them constituency headquarter openings or walkabouts. But the Ministry of Health doesn't have a position on this, whether this is safe or not.
I am uncertain how you would wish for me to answer that question. I continue to say to you, based on the recommendations we make and what is in the emergency orders, that is what we continue to recommend and we are guided by. If there is concern with respect to activities that are occurring, I understand that there are a number of avenues for individuals to make reports. I know that there is a number where you can actually report events that that you see occurring, and we encourage that. The Ministry of Health continues to make the recommendations that is based on the science. And certainly our recommendations remain the same. There should not be gatherings that are above and beyond what has been agreed upon and in the emergency orders, as well as you need to wear your mask. You need to continue to sanitize. I think in what I just, the address I just made, I made it very clear. Those types of gatherings should not be occurring. And certainly individuals have, a responsibility to protect themselves and others by not availing themselves of such events. Be they political, be they a party, be they a gathering of family, We have to continue to follow the public health measures. That is the only way we are going to continue to move down the road of being in the position that we all want to be in the position of. Vaccinations will continue to come on stream, and as we get more persons vaccinated, as I suggested earlier, we should be in a better position to, make recommendations as it relates to removing certain restrictions, but we are not there yet. So that's the only way I could continue to answer that question. Matthew Moxie?
Yes, good afternoon. There have been many reports of slowed response time from EMS, and we understand that paramedics are being held up at accident and emergency due to no available beds, and paramedics say they can't get their patients off of the gurney to respond to other calls in a timely manner. So I was wondering, is the hospital currently challenged with, I guess, overcrowding in the A&E department or anything of that sort?
Thank you for your question. I will ask Ms. Walker, Mary Walker, the administrator.
Good afternoon. Thank you for your question. There is a circular response to that question, in that if we're having an overrun of persons in the accident and emergency department, then it actually holds up the use of the gurneys when they are in the facility until we can free the person up off that gurney so that they can be admitted. We do have and continue to be faced with the challenge of persons having to be admitted for COVID. That means that the testing has to be carried out as per normal to ensure that we do not admit persons to a unit that are COVID positive, that where the other persons can be put at risk. As Dr. Jillian Bartlett indicated a few minutes ago in her response, when persons are tested initially, they may test negative, and then 5, 6, 7 days later, they test positive. Now, that has repeated itself several times in the healthcare facilities of this country. And as a consequence, when that happens, the patient populations are then a quarantine. They form a quarantine. That has resulted in us having to not admit further patients to that unit until the unit is cleared. All persons on the unit are cleared. So yes, we are having challenges with bed capacity. We will continue to have challenges with bed capacity until something is actually substantively done about it. We are also facing challenges with nurses and other allied health professions. So we've started this fight with COVID with these limitations, and we continue this fight with COVID with these same limitations. These are the same players doing all of this same work, responding to the regular demands of healthcare for this country, as well as the COVID challenge, as well as now the immunization exercise. We're all working in this cohesively together as a public health team. Thank you very much.
Thank you, Ms. Walker. And I am tempted to add to that. Certainly, as we move in the direction of increasing cases, I think Ms. Walker summed it up nicely. It's the same public health team that is seeking to make sure we do the vaccinations, keep the clinics open, keep the hospital going. And I think this is more reason why we are, we are, for want of a better word, begging that, we do our best to decrease the likelihood of transmission of this virus. It is with us. It is not gone. The cases are increasing now, and there is the concern of, moving into a third wave. So we are doing our best to continue to keep health services moving, as well as open up the vaccination sites. We ask you to continue to work with us, please, and let us all do this together. Jimanita Swain.
Good afternoon. So my final question, you mentioned the concerns as it relates to Guana Key and Green Turtle Key. We know that mainland Abaco has a curfew in place. I think those areas do not have curfews in place. In light of the concerns that you see with the COVID cases emerging, are you recommending any restrictions, and are you following up with those persons in isolation as confirmed cases?
As it relates to Guana Key, those persons who would have been tested would have come out of Guana Key into New Providence. They are here. But we are doing the contact tracing, and we are monitoring those that contacts of those cases. As it relates to Green Turtle Key, Dr. Bartlett would have clearly I think alluded, well, she did say that those were rapid antigen tests. We are following up with the real-time PCR test to determine, positivity with the real-time PCR test. But in the meantime, we are treating those individuals as if they, are positive, which means we must begin the contact tracing, and persons who are contacts will need to go into quarantine. And with respect to whether or not additional restrictions will go in place, as we continue to move forward with testing and monitoring, a recommendation may come forward. If it's just a cluster and we have it well managed, there may not need to be the recommendation for additional restrictions on those particular keys. But we are definitely monitoring that situation closely and seeking to determine whether or not additional measures would be required for us to be able to contain what is happening now. But I think you need to be assured that we are continuing monitoring, not only in Abaco, not only on the Keys, but across all of our family of islands. And the intent is for us to, as best we can, contain any clusters and decrease the likelihood of us having a third wave surge. So we thank you, the Bahamian public, and I believe that was our last question, and that ends our update for today. Thank you.